Hi, Dr. Ahmed with the Brain and Spine Institute. In this video, we're going to talk about a posterior cervical laminectomy infusion. Now, please keep in mind that these videos are meant for the patients being treated at this medical practice, and that this is a generalization. Each patient's experience may differ. Now, this surgery is performed with the patient laying face down. Typically, the incision is made in the middle part of the neck, and the length of the incision really depends on how many levels are being addressed. Once the incision has been made, dissection is performed through the soft tissue and the muscles to expose the spine. As you can see in this model, there are a lot of muscles that you have to cut through to get down into the spine. As you can see, once the muscle has been dissected, there are several blood vessels and nerves in the vicinity of the spine. Once the spine is exposed, bone is removed over the area where the spinal cord and the nerves are getting pinched. Now, this will vary patient to patient, and it is dependent on how many disease levels the patient has. So you can see that once the bone has been removed, the surgeon will be able to visualize the spinal cord and the nerves, and by removing the bone and the surrounding tissue, we will be able to achieve a decompression. After the decompression is complete, sometimes patients require hardware to be placed in the spine to maintain stability. And this involves placing tiny screws in the spine and being connected with a rod. The number of levels fused in each patient varies depending on the severity of their condition. Here's an example of a spine model with the exact same hardware that is used in this particular type of surgery. Now, this surgery lasts anywhere from 2 to 4 hours depending on the severity of surgery. Patients are typically in the hospital 2 to 3 days after surgery, and they are in a cervical collar that they wear around their neck. When patients ultimately return to the office at 2 weeks, the incision is checked and then physical therapy starts. Physical therapy can range anywhere from 6 weeks up to 3 months. Patients are usually clear to start driving anywhere from 2 to 4 weeks after surgery, and the same goes for work.